Well, indeed, cases of Covid-19 on the rise across much of Europe, and as we were seeing there in the United States. President Donald Trump in hospital still after that brief outing to wave at supporters. Cities are renewing restrictions, and the World Health Organization has warned the world to brace for tough months ahead. Some months into this pandemic, what are the latest developments? Well, to get his perspective on it all, we can speak to Professor of Epidemiology of Infectious Diseases at the University of Nottingham, Mr. Keith Neal. Mr. Neal, thanks for your time. Firstly, if we can, there's a lot of controversy this morning over Donald Trump's brief trip outside the hospital, many feeling it's highly irresponsible given that he has tested and is being treated for Covid-19. What would your medical take on all that be?
I think there's two ones. One is on the epidemiology and infection control, that he really put his security people at risk, even though he was wearing a mask, by travelling around in an enclosed space, aka the car. And I think he should be isolating and setting an example to fellow Americans and people around the world. Medically, if you're well enough to go home or to travel, that's completely different. And I'm not sure exactly how ill he is and how often he's getting oxygen, but he wasn't clearly on continuous oxygen when he was travelling around. I suspect he's got the milder end of disease and he was found by screening contacts rather than being diagnosed because he himself was ill initially.
So maybe unsymptomatic. And I guess after a certain number of days, our contagiousness with this virus also decreases. Now, we are being told that he is on quite a cocktail, though, of different treatments. Notably, we're hearing about this experimental steroid treatment, dexamethasone. Could you tell us more about that, how it works and what it would be for?
I mean, dexamethasone is a very old drug in the sense it's been around for years and years and years, and it's actually been treated for all sorts of inflammatory conditions and even things like mountain sickness. It's a very potent steroid, and it was the British UK recovery study that demonstrated this to be effective and reduces mortality in severe cases by a third. The WHO you mentioned says they only give it to severely ill people, but I think it's given how safe it is and without contraindications, I think there should be quite a low threshold for using it, certainly if you're ill enough to end up in hospital.
OK, so it could still be done on that precautionary basis, and it doesn't necessarily mean that Donald Trump had that very harsh version of COVID so far, in your opinion?
Well, he clearly walked to the helicopter to get to the Walter Reed Institute, and he was riding around in a car. He clearly isn't very sick and requiring intensive care and permanent oxygen. So without the need for oxygen, then he must be at the milder end of hospitalised cases. Given he's the president of a country that is the Americans have a very low threshold generally for treating people, it's difficult to be sure, but I suspect he is on the milder end of disease for an overweight 74-year-old.
Now, let's look at the treatments currently. We're a couple of months into this pandemic. How far have we come in being able to treat people, that are even more vulnerable to those more extreme cases of this virus?
We've learnt an awful lot, and it was a real shame that the WHO and China didn't do proper randomised controls back in the days of Wuhan in January and February. And as I said, it took the UK recovery trial to begin to show treatments that are effective. The remdesivir, so we've got dexamethasone, which is certainly, if I had COVID, ill enough to get into hospital, I would seriously want to have considered being given to me. Remdesivir on its own doesn't seem to actually increase survival. It does shorten your time in ITU, which therefore has an economic benefit, which is probably why the Americans have bought so much of it. The ITU physicians around the world have learnt more about how to manage this disease, and I understand there's less of a rush to ventilate. And the other thing that's been learnt is that nursing people in the prone position has been quite helpful at times. Usually people that are managed in intensive care on their backs and slightly propped up. And that will need looking into in the future as to whether that applies to other pneumonias.
Is the prone position turning over onto your stomach then to get air that way? OK.
Yes, it is.
Tell me, this COVID pandemic, it does seem to some extent like a lotto ticket. Some people who are young and healthy seem to get the very severe cases, and older people who are naturally more vulnerable get milder ones. When people present at hospitals, is there a structure to follow? Is there a commonality among all the cases?
I haven't managed any cases myself, but looking at generally published evidence, very few people under the age of 50 have got seriously ill and died. I mean, and particularly that applies to children and very young children. And we also know that majority of care home people, 94-year-olds who have had COVID, have survived. The majority have survived. So we come down to all sorts of parameters, and we tend to say, well, genetics must explain a lot, and it probably does.
And one wonders, maybe were there certain vaccinations we were getting, in certain decades that maybe potentially protect people to a certain thing. We are seeing, though, the numbers, the number of confirmed cases of COVID-19 rise. And we are indeed increasing tests, but it still seems like the percentage rate of people getting COVID is on the increase. However, a lot of people saying that it isn't as deadly as it was back in March. What do you make of that?
I think there's two factors here. One is that we're doing a lot more tests and we're diagnosing possibly 10,000 a day, when previously back in April, if we'd done more testing, we might have been finding 100,000 people a day. So although the number of cases is going up in numbers, we missed an awful lot of cases back in April and May. We're also seeing a lot of outbreaks in university students, and we know that respiratory diseases are very quick to spread. In fact, the various phrase fresh as flu, which is clearly not flu, but colds, coughs and colds, were known to cause a lot of mild illness. And COVID is spread in a similar way. So it's no great surprise that we're seeing outbreaks and clusters on universities.
Okay, and that explains the mortality rate being lower, as it is in that less vulnerable younger population. One wonders, at the start of this, there was a lot of focus on what we touched and the washing of our hands. Now it appears we've moved more towards this is transmitted via the air and wearing of the masks.
I personally have changed my mind on masks. The original evidence looking at flu was that we knew that the Southeast Asian countries spend a lot of time wearing masks, and it's almost universal in the winter outside, yet they're hit by flu identically to countries in Western Europe. So that really suggests that masks aren't very good at stopping flu. I think the evidence that masks certainly stop droplets coming out is you can almost make a common sense argument, and to prove that it doesn't do any good would take a lot of evidence. My own personal view is that we may even be showing a dose response effect now, in that it has been suggested that by wearing a mask yourself, not only will you protect droplets coming through, but you may end up being infected with a lower dose and getting a mild illness. This isn't proven, but I don't see any reason not to wear a mask, because A, you protect people, and B, you're possibly protecting yourself.
Indeed, I can't point out any negative to that either. Professor Neal, thanks so much for your time and giving us your latest view on this ongoing pandemic. Professor Neal there from the University of Nottingham. Okay, if you're just joining us here on Live from Paris, these are our top stories this hour. Fighting between Armenian and Azerbaijani forces intensifies, with strikes now hitting beyond that disputed region of Nagorno-Karabakh. And as we were just discussing there, after a brief outing to wave at supporters, Donald Trump is back in hospital for treatment of COVID-19. He says he has learned a lot about the virus in the last few days. Joe Biden's team says he should have realised the real risk of it all 200,000 deaths ago.